It's Monday, March 30th, and time for your Barbados Today morning news update. There's no evidence of community spread of the dreaded COVID-19 virus so far, so says Acting Chief Medical Officer Dr. Anton Best, as he gave an update on the 33 confirmed cases on the island. Speaking on the Current Affairs program Down to Brass Tacks yesterday, Dr. Best said the majority of cases were imported. That is, residents returning home from overseas travel. The others were identified through contact tracing. Investigations, he said, are ongoing with regards to community spread.
Out of the 33, 19 cases were imported, and these are usually persons who reside in Barbados who traveled overseas and came back and became symptomatic, and we therefore had reason to test them for COVID, and they were positive. 11 cases are through contact tracing, so persons who came into close contact with those index cases. We have 2 cases that are still being investigated. What we don't have is evidence of community spread at this point. So when you made reference to the tertiary level spread that Mr. Carter had previously mentioned, that's what we're talking about. Community spread, we do not have any numbers or any indication that it is happening. We believe it's happening, or it could be happening, and that's why we're looking for it. From a surveillance standpoint, we are constantly reviewing our criteria for testing because we want to find as many people as possible. And this is public health at its finest. The earlier we find cases, the sooner we can contain the spread by isolating those persons who are diagnosed with COVID-19. I can't, however, say that the 33 represents all of the persons with COVID. I cannot even tell you if it represents just a small proportion of the persons with COVID-19.
Dr. Best said all cases are in isolation and the vast majority of patients are showing mild symptoms, while there were some who are considered to be moderate. The Acting Chief Medical Officer also said it was too early to speak about recoveries.
We have tested people who have recovered in terms of their symptoms, but when we retested them, they're still showing positive. So only when that test that we use for diagnosis turns out negative can we say that that person has definitively recovered.
Also speaking on the program was Attorney General Dale Marshall. He said a plan is in place to ensure that law and order is maintained in the country if members of the Royal Barbados Police Force have to be placed in isolation or quarantined due to COVID-19.
We have spent a lot of time in the police force developing a plan to deal with this situation, the situation of COVID. Obviously, police are just like every other individual. Police can and do get sick. Nurses will get sick. Everybody has a chance of getting this disease. So our first concern has been, in the event that the Royal Barbados Police Force is hard hit in terms of people having to be quarantined or people falling ill, how are we going to make sure that Barbadians are safe? And I think that we have a very good plan, which will see a better utilization of our resources. We are looking at the prospect of actually bringing back up some retired police officers to help to shore up any short areas. But at all times, we're trying to make sure that Barbadians are safe. It is a good thing that too many people are not on the road during the curfew period at night, because that gives the police certain advantages.
Troubled and uncharted waters. That's how Governor General Dame Sandra Mason has described the COVID-19 pandemic affecting Barbados and the rest of the world. In a national address last night, Dame Sandra called on Barbadians to remain calm, follow the advice of health professionals, and focus on preventing further spread of the coronavirus.
We have all seen the news stories of how COVID-19 has overburdened the health systems of developed countries. It is therefore the responsibility of every Barbadian to cooperate with the government and designated authorities to ensure Barbados does not get to that point. Barbados is as prepared and as ready to fight this disease as it could possibly be. Under the Prime Minister's direction, members of the Cabinet, the COVID-19 SAR, the Chief Medical Officer, other health professionals, ancillary services and government teams have been working tirelessly on our behalf. We must comply with their instructions, guidance and advice, Keep physical distances from others and observe strict sanitary practices. Obey the law. Keep the curfew. Stay indoors. To do otherwise would be to undermine their hard work and put ourselves and our families in jeopardy.
She also urged Barbadians not to be paralyzed by fear and to rely on their faith.
Barbados, and indeed the entire world, is facing and fighting the novel coronavirus disease, now called COVID-19. Countries across the globe are quite literally on lockdown, with national borders closed, citizens confined to their homes, and commerce at a near standstill. We are in troubled and uncharted waters. Understandably, dealing with the unknown makes us uncertain, anxious, and fearful. But we must not let these feelings overwhelm or paralyze us. Our faith as Barbadians is enshrined in our national anthem. We must anchor ourselves on the knowledge that God is in control. With that sure belief, let us do our part and leave the rest to Him.
There's regional and international news after this short break.
It's Festive Friday at the Bridgetown Night Market at Pelican Craft Center. Kick off the weekend this Friday from 4 p.m. to midnight with loads of food, drinks, and entertainment. Get ready for Crop Over with the Rhythm Root Street Parade. Party like it's Kadooman Day on the street around Pelican Village with costume reveler, music, and more. It's Festive Friday. It's Festive Friday at the Bridgetown Night Market at Pelican Village Center from 4 p.m. to midnight. Admission free.
To news from our regional neighbors, a curfew is now in place in Bermuda as the country records 22 COVID-19 cases. In a national address last night, Premier David Burt said of that number, 10 persons are fully recovered, 2 remain hospitalized in stable condition, and the others are currently at home in isolation with mild symptoms. He urged residents to adhere to the curfew.
The decision to put in a curfew was not a ride that likely. However, we only have to turn on our TVs or look online to see how the coronavirus has impacted other countries and how healthcare systems around the world are being overrun, which is leading to misery and death. We do not want that here in Bermuda, and we all have our part to play in flattening the curve and limiting the number of persons that contract this virus at any one time. This will be done by reducing our movements and contacts with each other, and we must take responsibility for our actions, and we must obey the guidelines that have been given by the Ministry of Health. There are some who have asked, why is the curfew only in the evening and not during the day? The fact is that the more restrictions of which you can put on persons by having the ability to interact, the more opportunity you have to slow the spread of the virus.
And finally, the International Monetary Fund urged countries to approach the fund to contain economic damage caused by the COVID-19 pandemic. According to IMF Managing Director Kristalina Georgieva, the number of requests by countries seeking help from the IMF has been rising rapidly, with 50 low-income and 31 middle-income countries requesting emergency financing so far. She called on countries to access the fund's financial and monetary tools sooner rather than later to keep meeting the economic challenges during the coronavirus pandemic. That's news. But for the very latest, visit us at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media in bus terminals, as well as screenplay at supermarkets and gas stations near you. And you can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.